Thanks, John. Well, for 1 week in January, a team of doctors, nurses, and other healthcare professionals traveled to Haiti on a medical mission. And one doctor who participates is St. Louis and Dr. Paul Rottler. And thank you for joining us today. What was your first thought, because you were so close to the situation, having traveled to Haiti and helped so many people with medical issues? You must have thought, you know, they can't withstand this.
This is the last thing that they need. Every year I go back, we've been going for the last 6 years, and it never seems to get a whole lot better. They seem to take one step forward, 2 steps backwards, and this is the last thing they need.
I don't think people understand just how poor a country it is, and how, in terms of building codes or just buildings, they're so fragile anyway. And now, this incredible earthquake, the worst in 200 years, it must be devastating.
It looks terribly devastating. It looks like there's going to be a high casualty count, and it's terribly sad.
Are you worried? Do you have colleagues that are there now?
Yes, we do, and I am concerned. We've been trying to contact them without any luck so far.
So tell us about what your mission is there and where you go when you go to Haiti and what you do.
Sure. We've been going to an area called Pion, which is in the Central Plateau area, and I work with a team of an OBGYN and a general surgeon, and so I get to help deliver babies and do hysterectomies as a first assistant, and thyroids and colons, and they help me with the cleft lips and palates and the burns.
So your specialty is
plastics.
Plastic surgery?
Yes.
Okay, but you do a little bit of everything when you're there.
Well, when we're in Haiti, yes, we do.
And you are in situations where there's not a lot of great resources, running water, dirt roads, that kind of stuff, right?
There's no real infrastructure in Haiti. We run off a generator in the hospital. We bring all of our own supplies. The hospital is reasonably in good condition, at least up until now that I know of. And a lot of that's been with grants and help from private citizens in the U.S.
So when you talk about the hospital, the main hospital, I think there was a lot of damage done to that hospital.
Well, the hospital that I think you're referring to is in Port-au-Prince, and I'm talking about the one in Pion.
Okay, which is how far from Port-au-Prince?
About a 30-minute flight.
Okay, and luckily it seems like the airport, since last night, they were able to, you know, that's so important to get aid in.
Right. There's 2 main ports, Cap Haitien and Port-au-Prince, and those are the 2 main spots.
Well, so do you have it on your schedule to try and get there?
It's not on the schedule right now. I plan to go back every year. Just this year it didn't work out logistically for me. But certainly Haiti tugs at your heartstrings, and when you're there, it's like no other mission trip that you would go on. Unlike other third world countries, the level of poverty and malnutrition is so striking that you can't help but want to go back.
Right, and you do a lot of work with cleft palates and things like that, and young children. I imagine you've connected to a lot of the kids there.
Oh yeah, they're smiling. I mean, they always smile, and they have nothing, but they continue to smile.
But they don't have anything to compare it to, probably, right?
No, I don't.
Right. Well, good luck to you and your colleagues, and the next time you go there, and thank you for your good work. And I'm sure that they look forward to seeing you again.
Thank you.
And hopefully all your colleagues are safe.
I think if you go to my website, you should be able to link to be able to help the people there. There should be a link.
Okay, great. And if you go to our website, we'll give you that link to Dr. Rottler's website as well, so you can learn more. Thank you very much. Well,